Polycystic ovary syndrome affects fertility. How? Polycystic ovary syndrome is a disorder that doctors associate with an imbalance in female sex hormones. The imbalance can lead to a variety of symptoms and may affect a woman's fertility. Every month, in women of childbearing age, tiny fluid-filled cysts known as follicles develop on the surface of the ovary. Female sex hormones, including estrogen, cause one of the follicles to produce a mature egg. The ovary then releases this egg and it breaks out of the follicle. In women who have polycystic ovary syndrome or PCOS, there is an imbalance in female sex hormones. The imbalance may prevent the development and release of mature eggs. Without a mature egg, neither ovulation or pregnancy can occur. The hormone imbalance may also include an abnormal increase in testosterone, which is primarily a male sex hormone. Women also produce testosterone, although it is usually in small amounts. Causes. Experts do not know exactly what causes PCOS, but it may involve genetic factors. If a woman's mother or sister has the condition, she has a higher chance than others of developing it. Along with a genetic link, excess insulin in the body also increases a woman's risk of developing PCOS. Insulin is a hormone that the pancreas produces and the body uses to convert sugar in food into energy. Women with PCOS often have insulin resistance. Insulin resistance involves the body's inability to lower blood sugar levels correctly. Blood sugar levels can become too high, which causes yet more insulin production. Too much insulin also increases testosterone production, which leads to some of the symptoms of polycystic ovary syndrome. Symptoms. Symptoms can occur at any age or time during a person's reproductive years. Symptoms can also change over time. Some of the most common symptoms of PCOS include the following: abnormal hair growth on the face, chest or back, acne or a darkening of the skin, weight gain, thinning hair on the head, infertility, irregular periods, ovarian cysts, depression, increased skin tags. Not everyone with polycystic ovary syndrome or PCOS will have the same signs or symptoms. Effects on fertility. PCOS can affect a person's fertility in different ways. Ovulation problems are usually the primary cause of infertility in women with PCOS. Ovulation may not occur due to an increase in testosterone production or because follicles on the ovaries do not mature. Even if ovulation occurs, an imbalance in hormones may prevent the lining of the uterus from the developing properly to allow for implantation of the mature egg. Due to imbalanced hormones, ovulation and menstruation can be irregular. Unpredictable menstrual cycles can also make it difficult to get pregnant. Other complications. Infertility is often one of the main complications of PCOS, but it is not the only one. People with PCOS also appear to have a greater risk than others of high cholesterol levels, high blood pressure, heart disease, diabetes, weight gain, sleep apnea, depression and anxiety, poor body self-image, endometrial cancer. According to the WHO, about half of all women with PCOS develop either pre-diabetes or diabetes before 40 years of age. When to see a doctor. Anyone who is concerned that they are unable to become pregnant or who has symptoms that may indicate PCOS should see a doctor. Even if a woman does not wish to become pregnant, getting an early diagnosis of PCOS can help to prevent complications. There are many possible causes of infertility, but assessment for PCOS can help target treatment and improve the chances of conceiving. If a woman does become pregnant, it is also essential to know if PCOS is present, as studies have found a higher risk of pregnancy complications with PCOS. These complications can include gestational diabetes, premature delivery, high blood pressure during pregnancy. There is no specific test to diagnose PCOS. A doctor makes a diagnosis based on several factors. Tests may include a physical exam, medical history, blood tests for hormone levels, blood tests for glucose level, and ultrasound scan.